case count continues to climb. More than 2,400 cases were reported today, just days ahead of a province-wide lockdown. 2,408 new cases are being reported tonight. That's a jump by over 200 cases from yesterday. 41 more people have died from the virus, bringing the total number of deaths to 4,229. Taking a closer look at the GTHA, more than 1,600 of today's new infections are coming from this region. 629 new cases are being reported in Toronto, 448 in Peel, and just under 200 new infections in York Region. Hamilton and Durham seeing sharp increases with more than 100 each. Halton Region has nearly doubled its numbers from yesterday, reporting 88 cases. And in their final city update before the new year, Toronto Mayor John Tory and Dr. Eileen de Villa were expected to possibly announce tighter lockdown measures ahead of the holidays. But they say the most imminent and dangerous risk is one they can't control: private gatherings and holiday celebrations.
This Christmas has to be different.
With the city already under lockdown, hunkering down is the necessary and only next step. The message from city officials heading into the holidays: limit celebrations to only people you live with.
It is natural to want to rebel in some way against all the obstacles we face. But this is just 1 year of the unusual.
In the 4 weeks since locking down, COVID-19 case numbers in Toronto have remained steadily high. Today, more than 620 new cases were reported, 321 people are in hospital, 85 in ICU, and there were 17 additional deaths. The question now, has shuttering non-essential businesses and restaurants had any effect?
And that's a fair question. I'm confident the measures have limited the resurgence of COVID-19.
But there has been a resurgence at long-term care homes. The situation at Tender Care Living Centre in Scarborough has been described as a nightmare, with workers spread so thin that sick and dying patients aren't getting regular care. Almost half of the centre's 254 residents have tested positive for COVID-19, plus another 49 staff members. 26 residents have died from the disease.
They didn't learn from the first wave when long-term care, took so many lives.
Kelvin Lee's 93-year-old mother is one of the infected residents. He and his brother found out yesterday, but don't know what condition she's in.
They are out of control right now. They should have get more people, more external help like military involved like in what they did in the first phase.
The Prime Minister was asked about the situation at Tender Care today. He says the federal government is ready to lend a hand if the province asks. The Ontario NDP want the Premier to step in and appoint temporary management to take over the nursing home.
Lives are at stake right now. There isn't a minute to waste. There are a lot of people who are just simply being neglected because of the shortage of staffing.
In a statement, the Ministry of Long-Term Care says they are taking action to support the homes to improve infection prevention and control measures, shore up staffing, and ensure adequate supplies of PPE. Staffing needs at Tender Care are being met with agency staff, and North York General Hospital is providing medical coverage in the home. They add a ministry inspection is in process.
We also know that inspections take place and nothing gets done. If they were really serious, they would have put the hands-on care, they would have passed that immediately instead of looking forward to 2024 or 2025.
And a statement coming from Tender Care's management just moments ago. They say they are working closely with clinicians, physicians, and infection control experts to clear the virus from the home. Those experts are coming from North York General Hospital. They say they're also doing everything they can to reduce the pressure on staff. And meanwhile, the City of Toronto is investing an additional $3.1 million to help the city's most vulnerable populations.